we come to thyroid. Thyroid, I don't consider thyroid as an anti-aging hormone. Again, I will, and I emphasize on this statement again and again. Thyroid is not anti-aging hormone in otherwise euthyroid individual. When you talk about hypothyroidism, so hypothyroidism itself is a well-defined clinical entity. We don't have to talk separately about it. Hypothyroidism is such a clinical entity which we have been reading or studying from our second MBBS. The most common endocrine clinical entity which has no dispute in terms of, see, workshop and discussions happen when there are debate and dispute on certain things. So andropause, menopause, somatopause, all things, because there is one school of thought which says that you should not worry about them. It is a common part of aging, accept it. One school of thought says that no, we don't want to accept it, we want to improve the quality of life. So there always been debate. But in hypothyroidism, there is no debate. If you have a patient of hypothyroidism, you have to treat the patient. Is there any other way? You have to treat, no matter how you are treating. Iodine deficiency goiter, in the past when there was no iodinated salt and all those things in the hilly areas, there you are providing iodine, right? But now in today's world, when you have iodinated area, and even hypothyroidism is prevalent even in the coastal area too, or globally, you are now relying on the thyroid replacement. The only thing which is changing with every time with the debates and all is the level of TSH, when to start, when not to start. That is all the debate. Rest all is there. Rest nothing has changed in last 30-40 years. Clinical features of hypothyroidism has not changed. Whether you are talking about your Tripathi as a pharmacological book, Satoskar pharmacological book, or our Davidson medicine book, or Harrison, or Williams, whatever book we talk, or Oxford textbook of endocrinology or medicine, hypothyroidism is universal. So in an anti-aging conference, talking about hypothyroidism is like, why are we talking about it? There is no dispute about it. Treatment of hypothyroidism. Got it? And hypothyroidism itself has its own pathological consequences in anybody, so it should be treated. So identify the hypothyroidism and treat the hypothyroidism. The only controversy or only debate happens is how to treat it, whether to give only T4, whether to give T3, whether to give combination of T3, T4, whether to give nothing and only the nutritional supplement. This is the area of